Okay, so what was the first big goal you achieved, um, what let you know you were on track, and why was this whole big thing significant?
I don't know if there's one goal that I had. Like, I published my own book, so that was a huge goal for me. I always wanted
The
to be a
first
published author.
practice goal, like where was the first point in your practice?
Well, again, it was getting my schedule full, right? Like, that was it. Like, I knew I was on the right track, that I was gonna be a successful chiropractor, that 3 months into being an independent contractor, I'd already filled up the Monday, Wednesday, Friday slots, and now I'm working on Tuesdays, Thursdays, and Saturdays.
Nice.
That was probably my first goal, is just patient numbers. But the bigger goal was, how am I positively influencing my community, right? Like, what am I doing to leave behind my mark on our community? So I've done different types of proclamations where I've had our mayor declare like the chiropractic health month in October. That basically, it's like a non pharmaceutical pain management month, and had like a big thing where I had all different types of practitioners on non-pharmaceutical practitioners, right? Reiki healers, massage therapists, um, post EMF, like all different practitioners. And we hosted like a big event that was free to the public, and people could come in to learn about holistic modalities. And at the end of that, we had a proclamation signed by the mayor saying, like, this month is forever pharmaceutical free pain management month. And that was a really significant thing for me, that I thought was really cool as a goal, because I want to not just be a chiropractor, I want to positively affect the people in my town. So I've done a lot of reach out with like addiction services. I've done a lot of talks about drug misuse disorder, and about how, like, opioid should not be the first line of defense, and chiropractic care should be the first line of defense when people are dealing with musculoskeletal pain, and just a lot of different things to help our communities. Like, so big events where I would have our hospital's behavioral health unit there. We would have there's a local nonprofit that deals with addiction. So have that nonprofit there, so that people knew, A, they weren't alone if they had a family that had, an addict in their family, but also that, it could happen to good people and good families. Like, it's not just for people that are, down on their luck. It could happen in rich counties with good intentioned parents to anybody. So just to kind of demystify the fact that, opioids are not great, and that, chiropractic care would be the best place to start if you are having musculoskeletal pain, because it is not habit forming and it does have great results. So just giving back to my community as a chiropractor, I think, is the biggest goal that I could achieve.